We've been delighted to work with Friends of Cross for many years now, and they have played an instrumental role in advancing our translational research studies. We're all working on the same mission to improve patient outcome for all cancer patients. And what we want to do is we want to really increase cancer survivorship across the different cancer types, and in particular those dismal cancers with survival rates of less than 25–30%. So we would hope that the translational research studies will allow us to better understand how tumours develop, how tumours grow, how tumours metastasize or spread to other parts of the body, but more importantly, develop new therapies to be able to treat those patients that are currently not responding to the standard of care therapy. The Friends of Cross has been instrumental in raising funds that actually purchase very important pieces of equipment, and specifically the hypoxic chambers and the seahorse machine has allowed us to culture these tumours in an environment that would replicate how they grow in a patient's body. We can come in with our drugs that we're developing and to see how our drugs act in these environments.
The first thing that hits you when you get the diagnosis is it's a real sense of shock. People talk about a battle with cancer. I would rather use the term war, because it is a war. So life is good, but it's good because of the research, the development, and all of the effort that goes in on the medical side and the continuous improvement that the medical team seems to be doing. Even in my 6 years dealing with it here in James's, I'm conscious that they were learning things with me and from others. Like, I'm only one of thousands. 6 years later, they still have me in for checkups associated with the trials. I think it's good. I would encourage it. And if Friends of Cross and the Trinity campus here on site keeps developing those trials in all aspects of cancer, it's the right thing, it's the good thing, because the more we know, the more we learn, the more we can develop, the better it is for future people. Unfortunately, we're going to have the same or similar problems as I have or had. Keep supporting the trials.
Everybody's cancer is different, but if we understood that better, we could apply it so that patients will just have treatment that works for them. And there's never that chance of giving somebody treatment that has no chance of working for them. So knowing that has to inevitably improve patients' outcomes. Research, of course, is to develop new drugs and new therapies that will make a difference, a kind of a magic bullet that could make a seismic change. There's so much that science can do just to personalize cancer care for an individual and improve chances of cure.